well.
Okay, and we talked about if you were, I know this can't happen, but a try-in period. You said, okay, denture wearers come in on a Friday, give you just 2 implants. You said on Monday, nobody could go back to their loose-fitting denture. Do you believe that?
I can't believe that anybody would ever be used to the idea of a denture that does move a lot. I mean, wouldn't you really rather have your own native teeth or something that's very close to that, as opposed to something that you have to adapt yourself towards in terms of not only social interaction, but just basic chewing?
Interesting.
Yeah.
You know, I don't know if I told you, my father, 77 years old, just got his dental implants, 2 on the bottom.
No.
He's a trumpet player. And he said, and by the way, I know we're not supposed to say painless. According to him, 0 pain. But he can play the trumpet much better. Because, you know, the forces, I guess, against the lower, no pain, feels good, and says he wishes he would have done this years ago.
Oh, yeah. I can believe that.
Interesting. So a lot of people, so 89-year-olds now you run that study club. What's the oldest dental implant patient you've ever heard of?
The oldest one that I've heard of is 95 years old. 95.
Now, now on the 89-year-old that you did you get a little nervous?
No, not really. No. The only anxiety, if you like, associated with operating on somebody in that age group is just to make sure they're healthy enough to maintain their ability to go through the actual procedure and anesthesia.
So even with a little osteoporosis or whatever, people could be made candidates. Because if you're 75 years old, you have a little bit of osteoporosis, right?
If the patients who are coming in are on bisphosphonate medications, like Actonel, Boniva, Reclast, those kinds of medicines, typically what we like to do, if at all possible, is to stage the procedures, remove the teeth, and have them grafted first to find out how they heal.
Okay.
Because as you know, these medications can sometimes create issues with delayed healing in the jaws.
Interesting.
The normal protocol for operating nowadays in that realm is to have the patients off the medication for approximately 3 months.
Okay.
Do the procedure, wait for an appropriate healing time, and then start back on the medication again. If there are issues with healing, we want to make sure that we keep the surgery to a minimum.
Okay.
And obviously that's also done in conjunction with consultation with their doctors.
Okay, good. Now, do you think people think, you know, you mentioned 89 years old, 95 years old.
Mm-hmm.
Do you think some people, denture wearers watching this, that's one of the reasons they don't do it, because they think they're too old?
Yes.
They self-diagnose and say,
sure.
I don't have enough bone.
I don't have enough bone, or I'm too old to get this.
Have you ever had somebody come in and say they were told they didn't have enough bone?
Oh, yeah. Part of the beauty of continuing education, specifically with working with Dr. Moy and also through the Academy of Osseointegration, is that I've been exposed to some leading edge technologies which allow us to redo or regrow bone, where in previous times it may not have been possible.
So the patients are, do you think there'll be a trend where the patients start getting older and older, meaning people are starting to get the word out?
Yeah,
come in?
I think so, because the procedures that we're doing now are less invasive than they used to be, meaning that we don't have to go in and remove hip bone or even take bone in certain instances from other places in the mouth to be able to reconstruct jaws that otherwise couldn't have bone.
I mean, when you say you do surgeries on a computer, what does that mean?
What we're doing is virtual surgical planning with the patient's jaws to be able to simulate what the surgery is going to be like.
Okay.
It's like flying an airplane in a simulator. We're able to determine where the implants need to go and what structures under the gum that we're looking to avoid. We can also determine what the quality of the bone is we're planning on putting the implants in, which allow us to be able to structurally give them a really solid result.
Now, is it true, by the way, I mean, you guys have guides, like a guided surgery, where it's like goes over their gum line and there's holes in there in some cases.
Right.
You just go right in there.
Yeah. The procedures that are done virtually on the computer are transferred by CAD/CAM or by the computer to a solid three-dimensional model, which is then taken and placed into the patient's mouth at the time of the procedure to allow us to give the exact positioning of where we want to place the fixtures.
So the patients that get, okay, so the denture wearer comes in, they have one of these teeth in a day or all on four in the same day. How soon can they eat?
If it's an all on four technique, meaning 4 implants with an immediate fixed denture.
Teeth that don't come out.
Teeth that don't come out.
Okay.
You can eat after the anesthesia is worn off, which essentially means that evening.
Really?
They can be
Do they do
loaded
that, though?
immediately. Some do. Some do.
Okay.
Some are a little bit more adventurous than others.
Do you like them to wait about a week?
I personally do. Yeah.
You know,
I would prefer to kind of increase the density of the food after they've gotten used to the idea of having teeth that are not going to be coming out.
Now, you know, if 70 is young today, no doubt about it.
Right.
75 is young today. And, you know, everybody knows you got to have a lot of fiber. Well, it's hard to eat broccoli and carrots and things like that, vegetables, if you have a denture.
That's true.
Right?
Especially if you have one that moves around a lot.
So this will allow them to do all that.
It increases their ability to do that significantly.
How miserable are denture wearers, by the way? When you hear some of the stories they come in, what do they tell you?
Miserable, sometimes pain, meaning that, oh, yeah, you know, this denture rubs against my jaw down here and it hurts because it doesn't fit well. But I think miserable also means not being really comfortable in social settings, having circumstances where are my teeth going to come out?
Like dating. I mean, people are dating at 75 on Match.com.
Having to deal with all the glue that you have to put in there to hold the dentures in place. I mean, who wants to do that?
Okay.
That's just miserable. That is miserable.
Is there a tipping point that you hear every once in a while where they say, you know, this happened and I had to do something about it? Do you ever hear any of that?
Yes, I do. Oftentimes it's the spouse that's telling them, that's enough of this. I'm tired of you complaining. Go in and get this fixed.
Is that right?
Oh, yeah.
Okay. Now, do you encourage that?
Sure.
Bring in the spouse?
Absolutely. Because I think it's a decision that may affect both people, and I certainly like both of them involved in the consult.
Now, the other category of patients, people that have been told their teeth have to go. Okay?
Right.
Their mouth's a mess.
Right.
They all have to be extracted. It's a choice between dentures or dental implants. Always get the dental implants, you're saying.
I think dental implants offer many more significant options.
But what if their gums are bad, by the way?
Once the teeth are out of there, the gums are going to heal.
Okay.
Once the teeth are gone, the gums get better. That's the bottom line. So, and implants don't decay.
All right.
Okay?
All right.
So if we are able to replace what they have with either all their teeth or bridges or dentures that don't come out, like you said, that stay in place, and this gives them functional and aesthetic results that they're looking for, hey, we got a real winner there.
And they look good, too. I mean, you can make them look like
a
beautiful set of teeth.
Yes.
Okay, now what is this? This is pretty graphic, by the way.
And this is a fellow that I saw approximately a year and a half ago.
Is that common? I mean, what's going on there?
It's more common than you think. You just don't see these people because they're afraid to show their teeth.
Okay.
They don't want to show what they have in public. So, as a result of his particular circumstance, he was referred by a doctor that I work with, and we were able to help him out.
So what did you do for him?
What we ended up doing was removing his teeth. We saved a few. We were able to save a few of them, but we removed a majority of them and replaced them with implants. And now he has fixed implants, meaning crowns and bridges that don't come out, that have completely replaced what he had that was destroyed.
Now, people like this, by the way, in this very graphic photo, you say it hurts to chew, a lot of bleeding.
Bad breath, bleeding, soreness, continual pain, embarrassment. They don't want to be seen.
Do people hang on to their teeth too long in certain cases?
In certain
like
instances,
this?
Yes. In this particular case, the longer those teeth stay in there, the more bone loss you're going to experience, which starts limiting how much our options are in terms of being able to replace them with regular teeth again.
Okay, so in a case like this, when it's all done,
right?
This guy's got to be happy.
Oh, he's ecstatic. He's ecstatic. He told me that for the longest time, he knew he needed treatment, but he's ashamed to admit it. And now that he's had this done, he's smiling more, he's more active physically, he's more involved with his spouse. He's basically an individual who's come out of his shell, and he's very, very happy with it.
Now, we are out of time, but let's give a recap for the denture wearers, because you say no more dentures, get a fixed set of teeth in just a few appointments.
Right.
So show us the models again and what the denture wearers... and do you show these to for
Oh,
the patients?
sure, absolutely.
Okay.
I think that seeing pictures and models are a lot easier to explain than doing it verbally, at least for me.
Okay.
We can do as few as 2 on the lower, which would be placed in roughly at the corners of the mouth, which would help stabilize the lower denture, snap in, snap out. We can place more than that. And again, I'm having trouble pulling this off. But essentially,
is that an accurate model? I mean,
this is a very accurate model. It's very tight.
Now, this is not. You're not okay. I'm able to pull it off because I take it from an angle.
Okay.
With this,
yes,
this is like 4 implants.
4 implants with the denture snapping in over the top.
Okay.
Now, sometimes that denture can be screwed into position and be removed by your dentist, or placed in and not removed, such
like
as
that.
this. And in this case, basically, these teeth are being delivered on the same day that the implants are being placed.
And that's at teeth in a day.
That's right.
All on 4.
All on 4 teeth in a day. That's correct.
So what about maintenance with that? Like a water pick?
A water pick.
Brushing?
Yeah, electric toothbrush or
they
water
don't stain?
pick. Well, they stain just like your regular teeth would.
Okay.
But no different. Initially, there's a temporary denture that's in there for approximately 6 months, and that's replaced with a permanent one.
Now we're out of time. Final message to the person: either they've been told their teeth have to go, maybe they think there's no hope, but especially to the denture wearer. What do you say to them? Final message.
Final message is this: if you feel like you don't have options, I'd be more than happy to talk to you, because I think you do have options. And I think that if you're in a situation such as the picture this gentleman is here, we have options for you as well. And I'd love to have a chance to be able to sit down and visit with you on those.
Okay, great. And they can go to your website, find out more information.
Absolutely, yes.
And meet with you.
Yeah.
All right, good. I want to thank you for coming on the show.
Thank you.
Very interesting. Good stuff.
Thank you very much.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, you go to our website at wellnesshour.com and just put in Dr. Peoples' name. It's easy to remember, Peoples, and or put oral surgery Houston. You'll find it that way too. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.